topic in the chat box and the speakers will try to answer them. So the first speaker for today is Dr. Tushar Mehta, an orthopedic surgeon who is a blend of academic excellence and entrepreneurship with interest in all aspects of bones and joints. As an orthopedic surgeon, Dr. Tushar Mehta is one of the most academically inclined and innovation oriented surgeon. He is an extremely prolific surgeon and a coveted member of several bodies of orthopedic associations who is dedicated to develop the career in learning and teaching the advanced technique of orthopedic surgery. I would now request Sir to please enlighten our audience.
Hi, very good evening to all the listeners and all the viewers of this session. I'm Dr. Tushar Mehta, and I'm really thankful to this platform of mentor Mitr to call me for this session. Well, my basic aim of this session is to talk about the situation that we are in right now. So, as everybody is aware of the fact that it's an unprecedented event which is going on right now, COVID-19, as we're aware of it. Though very ironically, we started in 2019 and now we have landed in 2021, and still, the mess is still there, the mayhem is still there. So I want to talk about a couple of aspects of this particular pandemic, out of which, not as an orthopedic surgeon, as a doctor, as a friend, as a fellow countryman, my first aim, my first target is to reach out to viewers, and from those viewers, I want to reach out to thousands and lakhs of people all around. Is about the timely testing. In our first wave, there was a strict lockdown last year, so majority of the people were at home. We never had this much amount of infectivity and the positivity that we have today. But as of now, still, a significant population is not aware, is not alert, is not awake, and that is why they're ignoring their symptoms. So my first request out there is that whenever you have any symptom related to COVID-19, that can be fever, that can be cough, it can be cold, it can be sneezing, it can be even these days rashes or even loose stools, your target is to ensure that you get tested in a particular frame of time, because early testing is the first key to success. And as I was saying yesterday also to one of the team of doctors, that well begun is half done. So when I say well begun is half done, I, from the part of the beginning that I'm mentioning here, I mean only timely testing. Now, once get tested, the test comes out to be positive, then I would like to inform everyone here that how this entire process goes. This entire process goes in a very simple way, that a virus enters into your body. I'm telling you, standing on a platform of being a doctor, I'm telling you that the virus is not that lethal. It is infectious, it is contagious. One person, it is very easy to get transferred from one person to another person. But believe me, it is not that lethal. The only important fact is that it enters into your body, through a droplet infection. It is having a lifespan of 4 to 5 days. You are taking steam in the initial period. That's good for the clearance of the airway, but that's not going to kill the virus. So please make sure that the public is made aware that it is not going to kill the virus. No steam is going to kill the virus. The virus has its own course. It is going to enter into your body. It is going to be there for 5 to 7 days. In those 5 to 7 days, eating ivermectin or doxycycline or azithromycin or some vitamin C, vitamin D, zinc, taking steam, some GADA, some other sort of honey syrup, nothing is going to help you. These are just temporary, transient, symptomatic methods that we all Indians are following for the last 1.5 years. So what is my second point here is that after a timely test, you have to go for an early intervention. Now, when I say intervention, that does not mean that we go for these intervention. We have to understand the cycle. So in 5 to 7 days, virus is going to get killed, or it is going to get, mellowed down on its own. But what happens after fifth day? What happens after fifth day is that it leaves behind an inflammatory storm where there are a lot of inflammatory markers. In layman language, the lungs get affected. Why do they get affected? Because the virus is almost gone, but lungs sense some kind of a thing in the body, due to which they go into a very rapid phase of contraction and relaxation, contraction and relaxation. You have to understand it like that. And there's a very severe inflammation that starts in the body, and it creates a kind of a storm, because of which all the blood parameters, they go bizarre. Anybody who's diabetic, the sugar levels, they go uncontrolled, and level of platelets start dropping, and there are multiple systems which are affected because of that inflammatory storm. So technically, what time do we have? What is the golden period? The golden period is first 5 days. That is why I always say that you get your test in time, and then whatever intervention has to be done, it has to be done early, and not only early, it has to be aggressive. Now, when I say aggressive, that means using certain medicines apart from those typical prescriptions which are running all around in the country, including zinc and D and C and ivermectin and all those things, using certain medicines like the one which is quite renowned these days. I mean, although AIMS protocol recently has put it down, but still it is very effective. Favipiravir. So favipiravir is an antiviral drug. Although it is a latest drug, it is a recent drug. It came only after COVID came, but still early intervention with favipiravir has got a good role. If you detect any sort of a fever which is not controllable with a routine dose of paracetamol, you can think of steroids. Early intervention with steroids is also a very good thing. So when I say early intervention, that means intervention within the first 5 days. And if you intervene within the first 5 days with the help of, apart from those regular medicines, if you intervene with favipiravir, and along with that, if you use steroids, I'm telling you, believe me, you can avoid a major mayhem into your body that is going to start after fifth day or probably sixth day. Now, there are certain do's and don'ts which I want all of you to understand is, I told you that it has a lifespan of 5 to 7 days. After 5 to 7 days, it is going to create an inflammatory storm into your body. So, what does the most important do? The most important do is that even if at fifth day or sixth day or seventh day, you have a constantly declining oxygen saturation, or you have a fluctuating oxygen saturation, which I'm sure all of you are aware of, the pulse oximeter now. So if on that pulse oximeter, if you have a declining saturation or if you have a dropping saturation, my request is please go ahead with an HRCT. HRCT, the high resolution CT scan of your chest, of your lungs, is going to tell you that what kind of an inflammatory storm has already happened and it is about to happen. But you cannot get the clear picture before fifth day. It is happening in the country. People are misusing HRCT. They are getting their COVID done. They come positive next day. They go for HRCT. They don't see anything in HRCT. They call me, "Are doctor, I have nothing in my HRCT." I said, "This is day two. On day two, anyways, I'm not expecting anything in HRCT. Anything and everything which will be there in HRCT will come only after fifth day." So that's the first do, that you have to get your CT done, which public has been aware. So now they're getting the HRCT. So my point here is, please get it done. There's no point in, there's no nothing wrong in that, but you have to get it done only from fifth day onwards. Now, what do you see in an HRCT? Again, that can be treated with, of course, steroids are the mainstay. Remdesivir and all these medicines, they are supportive medicines. They are just going to decrease your hospital stay. They are not going to decrease the mortality. They might you help in the morbidity. So steroids are the mainstay. Oxygen is the mainstay. If on 5 liters of oxygen you are maintaining an adequate oxygen pressure, oxygen saturation, I feel it is fairly decent and reasonable. And along with that, if you aggressively treat it with steroids, so I think the situation will be under control. So that's one do that I want all of you to understand. Now, there are certain don'ts. The first don't with this platform, I would like to inform everyone who's watching and listening me, the first don't is that please do not try multiple prescriptions. Do not try multiple doctors. Do not go for certain parameters which are circulating online, which are saying that you can eat this and you can have this, and there are certain myths which are going all around. Because I'll be covering my fourth pointer here also, that won't fall for myths. There are certain myths going on around us. Please don't fall for them. There is no nebulizer which can work as an oxygen cylinder. There is no concentrate oxygen. Now, as of now, I'm talking about today, as of like 25th of April, the entire country is going gaga about oxygen concentrators. Any oxygen concentrator that you buy today is not going to help you if your oxygen saturation at room pressure and temperature is going below 90. That is going to just support you for a couple of hours maybe, but that is not going to be the final treatment. People are buying it, people are hoarding it. This second wave of pandemic, I think, is probably because of errors at three components. First is definitely the the system. Second is definitely the mindset of the people, that they're just hoarding things for as a precautionary measure. And the third thing is a lack of awareness. So I'm very happy that with this platform I'm creating, or probably I'm trying to create some awareness, that all these things that you're running for, all these things that you're holding, are not going to help you. They're going to help you only if you develop that severe phase of the disease, which most of the people are not going to develop if they follow the protocol that we are discussing right now. So please ensure that there is a very important do, that follow the protocol, that initial 5 days, take symptomatic treatment. You can add a bit of steroid, you can add a bit of favipiravir. Fifth day onwards, if you feel that your fever is not controlled, your cough is not controlled, you are having multiple spikes of fever, your saturation is fluctuating, please go ahead with HRCT. And then according to HRCT, you need oxygen, go ahead. You need steroids, go ahead. You need remdesivir, go ahead. But majority of the people, if they get their CT done on fifth day and they follow the protocol of oxygen and steroids, most of them will be sorted in their, in their health. Now I will come to my second last pointer here, which I think has been one of the very major reasons why we are in this soup right now: vaccination. I mean, I still remember somebody telling me that, in for HIV virus, for last so many years, people have not been able to make a vaccine. And now, Dr. Tushar, that in just 1 year of this pandemic, the world is ready with a vaccine. So we don't believe the efficacy and safety of the vaccine. I mean, what kind of an excuse is this? That you are relating to a disease of an HIV, which is going to infect only a certain category of people, and as you are comparing it with something which is so contagious and so so infectious, that just two people, if they don't maintain social distancing, the if one is affected, other one will also be affected. So I tried to convince them. I could convince some of them, but I could not convince many of them. And that is probably that reason that, I am in touch with almost 200 to 250 patients every day. And most of them are 45 plus. Most of them have not got the vaccination. Even if they've got partially vaccinated, and they're suffering now. Guys, vaccination was, vaccination is, and vaccination will always be a boon and blessing to all of us. Now, after 1st of May, if the younger generation is watching this, if after 1st of May, they're opening a vaccination for every age group of 18 plus, for all the, people of the country, my suggestion is please get it in time. It's not that, there's a panic which has been created because of the second wave, and then you're going for it, or something like that. I want you to be awake, aware, and alert. This is going to be a boon. This has already served as a blessing. I have got vaccinated. I got exposure to a COVID patient. I mean, I get exposure to COVID patient almost every now and then. But I've been tested positive 10 days ago. But there is hardly any problem that I faced, and I have good level of antibody, all thanks to the shot that I got. Even if you're vaccinated and you develop COVID again, that's not a problem. You will just have mild symptoms. In fact, I have proposed this also to certain set of people in the administration, that let's not call it a vaccine. I mean, the Covishield and Covaxin. I mean, I personally feel we should not call them as vaccine, because vaccine is something which can prevent the disease completely. So they are not preventing. Even after getting the two jabs, it is not going to prevent the disease completely. So we can call them as immunomodulators. Simple. They are modulating, they're mediating your immunity, that you have antibodies, and now even if you get exposure to a patient of COVID, your immunity is manipulated in such a way that you are infected, but you don't develop that severity of the symptoms. So that is the only thing. Of course, it is at the clinical end, or the scientific end, or the research end, which is happening. But for the layman, for the general public who's watching, who's listening, and I want all of you to be aware of the fact that vaccination is a boon. There is no confusion. Forget about all those rumors. There's one more rumor which is floating on Twitter since yesterday, that 1st of May onwards, all the women who are either in the period of menses, or who are pregnant, or who are lactating, should not have it. There is no data supporting that. Please, there's one don't that I'm sorry I forgot to mention. I'll mention it now. Please don't believe in the facts that you receive from this wonderful WhatsApp university that we have these days. Everything has to be backed by a logic, scientific logic, which has to be reasonable, which has to be, there has to be a rationale behind everything. So vaccination is something, the wave itself is now alarmed people to get vaccinated. But apart from that, yes, I want all of you to encourage all those people above 60 also, that they should get vaccinated before 1st of May, because normally we can very well imagine that after 1st of May it will be a little difficult for us to get vaccinated because of the ample amount of population and less supply of the vaccine. So please get it done. Coming to the last point is about post-COVID care. In the previous wave, of course, I did a lot of work, although being an orthopedic surgeon, but I have keen interest in COVID-19. So in the last wave also, I could see that, and in this wave also, although it's a mutant virus now, but still there is something that I've observed, which I want all of you to understand, that cough is something which is persistent. Cough is something which is persistent till about a month, till about 2 months. Fatigue is something which is persistent right from 15 days to 5 months to 6 months. There is one more striking feature, that there is a rebound phenomenon which is happening, that a guy gets COVID, we treat him, he gets fine. 14 days later, there is no need to get another test. By the way, there is no standard operating procedure which says that you have to get a repeat test to be tested negative to declare that you are not COVID positive now. If you are a COVID positive patient, you are isolated and you follow a treatment for a period of 17 days. After 17 days, automatically we feel and we believe that you are now COVID negative. Although you still have to, if you are not vaccinated, you still have to go for vaccination and you have to still wear a mask and follow the SOPs. But what I'm trying to tell you is that three things. One is cough that I mentioned, second is fatigue that I mentioned. The third thing, which is very ironical, is 20th day, 25th day, 30th day, a rebound fever is coming. But that doesn't mean that COVID is back or something is back. That is something which is what we have seen in the second wave. Still, I mean, the scientists and the researchers are still finding a scientific logic behind it. But yes, there is a rebound fever which is also seen on 18th, 19th, and 20th day. So, in post COVID care, what I tell everyone, the most important part is stay hydrated. Every morning, you have to ensure that you fill 3 water bottles of 1 liter each. 3 liters of water per day is the most important part of the post-COVID care, because if you remain hydrated, then you sort majority of the issues. Second thing is, you can always keep paracetamol along with you. Not only it is going to help you with the fever, but this is also going to be a very good drug for the myalgias that you have. I hope you understand myalgia. My means muscle, algia means pain. So all these diffuse muscle aches and pains and fatigue and body pain and joint pain that you're going to suffer even till about 3 months from the COVID recovery, paracetamol, 500 or 650 mg is going to be really helpful. So first is hydration in post-COVID care. Second is definitely, the paracetamol. Third thing is always the steam, because somewhere down the line I have given you the life cycle of the disease, that from 5th to 7th day you're going to have, after that time you're going to have some inflammatory kind of a reaction going on in your lungs. So even if 17 days have passed, your saturation is normal, you don't have fever, but still something is going inside the lungs. Taking steam is not going to kill the virus, as I said earlier, so there is no logic behind it. It's just that when you take a steam, the nasotracheal or airway or the orotracheal airway, so they get cleared. That's the only thing. If there are any secretions or if there is any obstruction, you get cleared. So steam is just like a symptomatic treatment, which I always advise along with hydration and paracetamol. Steam is also a very important part of post-COVID care. And yes, you should resume your work as soon as possible, because what I've seen these days is that, I mean, I would say that empty mind is a devil's workshop. Majority of the people, because of the fear of the COVID, they are not going out. If they have COVID, definitely they are. I'm not saying going out means just for maybe a walk in the society that you live, or maybe just looping yourself in some work, maybe an online thing. So what I'm trying to tell you here is that Netflix and Amazon Prime and all these things and YouTube, of course they are good for maybe an hour or two in the day, but ultimately you have to indulge yourself into the online activities which are going on in and around you, and the kind of online session that we are doing today. So you should try to attend all these sessions and webinars, because not only they will keep you updated with the knowledge, but also they will indulge your time and your space of your mind into that, and you don't develop all the negativities and all the news which is circulating on WhatsApp and Twitter. I can assure you, talking to certain statisticians who are ethical, who are reasonable, who are involved in this entire COVID task force, I can tell you that they are telling me that we will be achieving a peak in probably end of May, mid-May to end of May, and by mid of June hopefully we'll be able to see a end to this second wave, and that is going to give us a little relief. So, in my post COVID care, my first aim, my first target is always to tell you all that stay hydrated, take paracetamol whenever you think it is required. The third thing is that you should take steam as and when possible. Fourth thing is please do not leave an empty mind, because that is going to be at the devil's workshop. So, indulge yourself into your passion, into a hobby, into a habit. Go back to your professional space, attend online things, do your work online. Mask is something which is always emphasized upon. We've been emphasizing upon right from day one, when this all started, that whether you are vaccinated or not, whether you take remdesivir or not, whether you are taking precautions or not, mask is the only thing which is always going to be with you as your companion. And from where I'm standing today, I can see that masks are going to be a very important part of our lives for at least another 5 to 10 years. And I think that is how it is going to be. We can't help it. So I would just summarize my points here, that an early testing, aggressive intervention in the initial phases. There are certain do's which you have to follow, which I have told you, but in certain don'ts, the first thing that I've already emphasized and I want to emphasize upon is that please trust your doctor. Trust one source rather than running for different sources and going haywire and going bizarre and following all these things which do not have any scientific backing. Please don't do that. There are many myths which are going around in and around, that this can worsen the COVID and this can benefit the COVID. If anything you feel is scientifically approved by a logical man, please go ahead. Otherwise, please don't fall for all these things. Vaccination was always a blessing. It will still be a blessing. So, all those people listening to me less than 45, please get yourself registered. I'm sure by now you must have been informed that a valid registration is necessary for the vaccination on 1st of May. Various portals are going to open up. So please, be aware of that you get yourself registered as soon as these portals open up. And as far as the post-COVID care is concerned, I would advise all of you to keep your mental sanity, to work on not only on your IQ, but also the EQ, the emotional quotient, and try to take care of yourself. You yourself are a priority, your family, your loved ones. Stay hydrated, take steam, and just don't let your mind go haywire, blank in the space, because it is going to give you negativity and nothing like that. So that was, I think, my talk about certain pointers that I wanted to discuss about the COVID thing. Thank you so much.
Thank you so much, sir, for busting so many myths and clarifying the do's and don'ts. That was actually very important. As you said, in the era of WhatsApp University, we actually, get lined up in the rumors, and it spoils everything according to me. But you've actually cleared all the doubts and myths. So thank you so much for that.
Thank you so much. It was really a pleasure for me to be a part of this session. And I would like to congratulate this platform of Mentor Mitra, and I wish them all the best. And I just hope and I wish that, they go leaps and bounds and they create a lot of awareness. There is only one thing that I want all my fellow countrymen should have. You guys should, there is a need actually for that. We all should be awake, aware, and alert, because this is something which I think Mental Mitra also has a kind of a vision which I could imbibe from the time that I had a conversation with the people and who are taking care of this Mental Mitra, that creating awakeness is very important, so that you're alert, you arise, and then only you'll be able to understand that in this pandemic, all these things that we are doing are going to help each other. And I would request all of you to please pay your part also, because see, we all have a kind of a role to play in managing this pandemic. So whatever you are doing, I think if that is helping people to be more aware, so I think you are going to help the overall situation in a whole, as a larger picture I see. Thank you so much.